specific role is as the Divisional Development Coordinator, which basically means I work with the branches in the Western Division, of which there's 7. And more recently I've also taken on the branches in the Northern Division as well, so I've got another 5, so 12 branches all up. And basically I work with the branches, so it's a very sort of community-oriented, grassroots type approach, working to help increase their capacity for things like good governance, management and operations, communications, that type of thing.
I've been working with the International Federation of the Red Cross and Red Crescent Societies. They have a Pacific regional office here in Suva, and this office has 14 members in the South Pacific, ranging from Australia, New Zealand, then out to Cook Islands in the east, and up to Palau, Micronesia, and Papua New Guinea and everywhere in between.
My assignment has been working with the Ministry of Health and the Fiji Health Sector Support Program on a program about amputation reduction due to the high NCD rates in Fiji.
So my role is basically health promotion. So there is 2 of us in the Western Division that look after 6 subdivisions, and that can involve things like health promoting schools, where we want the kids to be able to eat healthy or have physical exercise in their routine, all the way up to people who already have chronic disease, so diabetes, cardiovascular disease, respiratory disease and cancer.
Yeah, memorable moments. There's been quite a few actually. One that jumps to mind was working with another avid volunteer to put together the strategic plan for Fiji Red Cross. We did a large consultative process, and it was very satisfying for me being working so closely with the branches. It's been a good journey, a lot of lessons along the way. Obviously hosting workshops can be quite tiring, but also very rewarding as well. So yeah, that's the strategic plan that we've come up with. So it's also satisfying for the branches because there's a specific component in here looking at developing the organisation's capacity.
I think my impact has been to shore up the reporting and project management side and the accountability side of their work. They're a member organisation, but they run a lot of projects, and so the staff that we're working with have amazing technical skills in all their areas of experience, but they realised they needed a bit of support in their reporting and accountability and the monitoring systems behind that. So what I've helped is to help them explore exactly what the issues are, what the gaps are, and then in the last year just really work on filling those gaps with new tools or systems or recruiting staff with certain skills.
Being a volunteer in Fiji is fantastic actually. It's been a very rewarding experience. Red Cross is a bit like a big family, so we were very much taken in when we arrived and have gained a lot of strong friendships through that process, but it's been a very rewarding.
Personally, is the friendships that I've made. I know everyone says that, but it's actually really true. I've been lucky to be put with a counterpart who's become a really good friend of mine.
Having an avid volunteer helps me co-share the work, what activities, for example, will be the color explosion programs that we have done. The other one, we are working on this inter-ministry sports afternoon every Wednesdays. The other one is trainings that we are doing. Currently, this quarter, we are focused on 2 trainings, that diabetic foot care, and the other one is for motivational interview. It's done whole over Western Division. Yes. So she helps me to share workload. If I'm doing one program, she looks after the other program. So having an avid volunteer, it will be an advantage.
The Colour Explosion event is aligned to the government's national objective of reducing non-communicable diseases or NCDs in Fiji. On a personal note, the decision to stop NCDs starts with me. So on the home front, it all begins with the decision that my husband and I make.
Currently, I am based at the national level, at the planning and policy and administration level of the NCD program. I also had an opportunity to engage with some volunteers, avid volunteers, especially in the areas of physical activity, diabetes, digital communications, and also nutrition. Basically, the professionalism that they bring into the ministry and to the team. Basically, the cultural exchange. It is interesting to learn about the different cultures or even Australian culture and how they merge with our Fijian culture. And the third and final thing would be sustainability into the future. The programs that they bring or start in at the national level or at the community level, even after they go back, the programs are still continuing. It basically helped the staff with a different perspective of how to go about running programs or conducting programs. It brought about a change in our attitudes. It helped us look at issues more clearly and also address it a bit faster.
Catherine came along and she brought to bear her skills, and then hooked up with this statistician, she was able to make the numbers, the data, way more powerful. She put the drowning deaths in Fiji against a timeline, so we were able to have the seasonality built into it. So now we know 80% of drownings in Fiji happen during the cyclone season. You know, if you don't understand the problem properly, you can't address it, as anyone knows. It wouldn't happen without these people. It really wouldn't. Nothing would happen.